What causes blurry distance vision and squinting? Myopia. Imagine trying to see something far away and everything looks fuzzy or blurry. That's often what happens with myopia or nearsightedness. The main cause is the shape and length of the eye. In myopia, the eye is usually longer from front to back than normal, or the cornea, which is the clear front part of the eye, is more curved than it should be. This shape change causes light entering the eye to focus in front of the retina, which is the light-sensitive tissue at the back of the eye. Because the light doesn't focus directly on the retina, distant objects appear blurry. This happens mostly during childhood when the eye is still developing. The eye's length can grow too long, especially in early years, making the focal point fall short of the retina. Since close objects tend to focus correctly on the retina, people with myopia usually see nearby objects clearly but struggle with things far away. That's why distant images look blurry and why many people start squinting. Squinting is an instinctive response to try to sharpen the blurry image. When you squint, you slightly change the shape of your eye and reduce the amount of light entering, which can temporarily improve focus. Other signs of myopia include headaches, strain, and sometimes discomfort or tiredness in the eyes. People might also notice they blink more often or have trouble judging distances properly. It's important to remember that myopia is a refractive error, not an eye disease. However, if it is not corrected, especially if it worsens over time, it can increase the risk of more serious conditions later in life. These include myopic macular degeneration, glaucoma, and retinal detachment. Correcting myopia is usually straightforward with glasses or contact lenses that help focus light properly on the retina. Refractive surgery is another option for some people. Early detection and correction can help reduce symptoms and may slow the progression of myopia. So, in essence, blurry distance vision and squinting happen because the shape of the eye causes light to focus in front of the retina instead of directly on it. This makes distant objects look out of focus, and squinting becomes a natural way to try to see better temporarily. If you notice these signs, it's always best to see an eye care professional for a thorough checkup and personalized advice.